If you pick the wrong Medicare plan, it's not just an inconvenience that you can later change. It can end up costing you thousands of dollars per year extra, and you may not have the ability to ever change it again in the future. Hi, I'm Joseph Pate, better known as Medicare Joe. We've helped thousands successfully enroll into Medicare, and in this video, I'm going to walk you through what happens when you choose the wrong Medicare plan and how some people don't have the ability to change that later on down the road and they're stuck with that plan. So let me show you why this is something you don't want to have to figure out later on. We have clients that come to us all the time about enrolling into Medicare, and I see the same thing over and over. So let me paint that picture for you so you can kind of see what this looks like for folks and what happens when they do the let me figure it out later as opposed to figuring it out now. We see this all the time with clients. I had a client that we just spoke with, it was 2 weeks ago. We see it again, time and time again, where when she enrolled into the plan for the first time at 65, she was extremely healthy when she enrolled. No major health issues, exercised, very active, no reason to really expect anything that would come up. So through our client needs assessment, we laid out the options for her: Medicare Supplement, Medicare Advantage plan, and she chose the Medicare Advantage route. She felt that at that time in her life, the lower premium, the bundled care seemed like the right decision. She didn't want to waste any money on a plan that she wasn't going to use, right? These are the things that we hear from our clients all the time. And then everything changed for her. She was diagnosed with cancer back in 2024. And on the Medicare Advantage plan, she hit her out-of-pocket maximum. So that's the most you can pay in a calendar year with the plan of $8,000. She then hit her in 2025, that resets. Again, she then hit her out-of-pocket maximum again in 2025 of $8,000. So that right there was $16,000 over a 2-year period out of pocket that she had to come up with because of the simplicity of picking a bundled plan she had thought was best for her at the time. So, she's been a client now for a few years. We did her review a month ago, like I said, when I was speaking with her, and she had asked us, can I get out of this plan? I'm having a tough time coming up with these large sums of out-of-pocket costs. I want something more fixed, more of a fixed premium. Like you mentioned, we went over the supplement plan when she initially enrolled into coverage. The problem with that, and she asked me straight out, can I go to the supplement plan? Can I move to that? Because again, once you're in this rabbit hole of paying these out-of-pocket costs, it just gets extremely expensive for a lot of people. So she wanted predictability, she wanted stability. But here's the problem. When you have a Medicare Advantage plan and you're outside of your first year of enrollment into Medicare, a lot of times you need to health qualify to go from an Advantage plan to a supplement plan. And in certain states, that's not a requirement, but in a lot of states it is. And for her, because she had just had cancer, she's now cancer-free, but she had it within the last 2 years, she can no longer qualify to make that change. The crazy thing is that most people come to us with the same objective. They're all trying to do the same exact thing. They want affordable coverage. They want something simple. They want something that is all bundled into one package. So what happens is a lot of people end up choosing Medicare Advantage. It has that simplicity behind it. It has the bundled care package, and it's very similar to how a lot of folks would be insured when they were on an employer-based plan. But what a lot of people don't realize is it is not like an employer-based health carrier plan. There's a lot more limitations when you're on a Medicare Advantage plan, although it has that bundled effect. And there's a lot more out-of-pocket costs that can be incurred on the plan as well when you have that Medicare Advantage bundled effect. But what a lot of people don't realize is what happens when their health changes with that plan. Because it's not all about enrolling into a plan based on your health today. It's based on enrolling into a plan based on your health when you actually need it in the future. That's the whole purpose of insurance. If you want to move from Medicare Advantage to a supplement plan, you got to go through the medical underwriting to qualify. And for a lot of people that are on a Medicare Advantage plan that are healthy, it works fine for them because it's that simplicity of bundled care. But when they need care the most is when they start to see the negative effects of a Medicare Advantage plan. And that's when they want to jump ship. That's when they want to figure it out later, is what I was saying earlier in this video. And a lot of times there's no figuring it out. You're just staying put with what you have. So this is the biggest problem when people are getting onto Medicare and they're picking, when I say the wrong plan, it's because they might not be understanding the ins and outs of how they work, but they might not be able to actually realize what is that exposure of the out-of-pocket costs to me. What does that mean to me when I'm going to need the coverage the most later in life? So these are real problems that we get faced with clients on Medicare all the time. But the common theme is people just don't see them until it's too late. Again, Medicare Advantage is not bad. It just means you need to understand the trade-offs before you pick a Medicare Advantage plan over a Medicare supplement plan. You're trading lower premiums for a higher potential risk of out-of-pocket costs. There's a trade-off there. For people, it's important to understand that when you're balancing the two, look at the supplement plan. Look at what you might be paying in a fixed monthly premium every month. Compare that to the out-of-pocket exposure with an Advantage plan. And more importantly, don't make the decision based on today in your health, because you don't need insurance today if you're extremely healthy, right? We don't buy insurance for that one primary care doctor visit that we have to go to for the year. We're buying insurance to protect us financially from hardships that could come up should we have extreme things that happen, major medical conditions that happen. So when you're picking your plan, that's really what you want your focus to be on, is how do you want your plan to work when you need it to work, not based on your health today. So a quick recap on this video. Again, I want to just talk through the situations that we deal with clients on a daily basis. It might be able to help you with your decision making, but Medicare Advantage is a simple option. It is a lower premium option, but it does have that higher out-of-pocket exposure. So just understand what that means if and when you ever need to use the plan. The risks of that always show up when your health changes, and that is the time people want to switch from Advantage to a supplement plan, but you got to health qualify. So that's the second key takeaway. Moving later on when you're not healthy might not be an option. And then the third takeaway, if I can give any advice in this video, is pick the plan based on how you want it to work when you actually need the coverage to work later in life, not based on your excellent health today when you're getting onto the plan. If you're trying to decide between Medicare Advantage, Medicare supplement plans, making sure you're putting yourself in the best position, you can book a call with our team below. There's a link. And if you're just doing research on this and you have friends that might be on a Medicare Advantage plan, if you like the video, share the video with them. And in this channel here, if you click that red subscribe button, that'll notify you anytime we post new YouTube videos to this channel. We post weekly with updates and new information that you need to be aware of when it comes to Medicare. Thanks for watching.